From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello everyone, I'm Genaye Channel with my co-host, Dr. Andy Rosenzweig, Division Chief and Fellowship Director of Geriatric Medicine with Einstein Healthcare Network. And this is Aging Gracefully. Our topic is the risk of medication interactions. So let's get right to it. Why is it so prevalent with older people as far as their medications and their interactions with one another?
So there's a few reasons. Number one, older adults tend to accumulate more and more comorbidities and medical conditions for which doctors feel the need to prescribe medications for. Number two, as we get older, the way our body metabolizes and breaks down medications changes, which means doses are within our system longer and not always acting as predictably as they may in younger adults. Third, the older adult, especially in our community, uses a high number of complementary alternative medications, herbal supplements, vitamins, so on and so forth. And although those are thought to be benign because we can get them anywhere, they compete for the same receptors and enzymes that our prescription medications are and can cause lots of problems.
So whose responsibility is it as far as knowing the interactions with various medications that a patient may have? Is it the doctors? Is it the patients? Or is it the pharmacists?
I think it's everyone. The doctors got to understand that less is more in the geriatric population, and you really need to be very careful about just reflexively adding a medication on for a given complaint or condition. I spend most of my days looking for medications to remove from people's lists, and 9 times out of 10, they end up feeling better. I can't even remember to take my vitamin every day, and we're expecting these people to take 10, 12, 20 pills 3-4 times a day. I think we should rely more on our pharmacists. These are the experts in every pill that we're putting in our body down to a chemical level.
Right.
We tend to just walk in there, grab our bag and leave, but these guys have tons of information that they're more than happy to share with us. And then finally, I think it's the patient and the patient's family's a responsibility to know what they're putting in their body. And if something doesn't make sense or you can't place a medication for a symptom or a disease, well then ask the doctor why. And I think a lot of times advocating for yourself is the best way to keep a clean medication list.
So what do you think about caregivers sectioning off pills for a patient that they may be looking after? They have like the pill carriers and Monday, Tuesday, Wednesday, Thursday, Friday. Is that a good idea, or should the patient do them themselves?
No, I think it's a great idea. There's a lot of different ways. There's some pretty cool technology even. Things that look like gumball machines that will release pills at the specified times and notify the physician if they're missed.
Wow.
Whatever works to make sure the patient is taking pills as prescribed. I think is fine. I think what's most important is when you go to the doctor, you make sure he does what's called a brown bag checkup.
What is that?
So every time you go to your doctor, you should put every pill that you're putting into your body, whether it's a vitamin, an over-the-counter acetaminophen, or a prescription drug, put it in a bag and bring to the doctor so he can take out each bottle or the pill carrier and see exactly what's going into your body. I've seen some crazy situations where, mom and dad had all their bottles together on the kitchen counter, and pill bottles got mixed up. Mom was taking dad's pills and vice versa. I even saw one case where a patient had taken her dog's heartworm pills. Because all the pills were put up on the kitchen counter,
right.
and she got mixed up.
So what advice can you give patients out there for excess prescribing? How can they avoid that?
The patients need to advocate on their behalf, and we need to understand the idea that more is not always better. What we commonly see, or what I see all the time actually, different practitioners doing is prescribing reactively. So someone comes in and says, my knee hurts, rather than saying, let's figure out why your knee hurts. Let's talk about some non-pharmacologic ways we can treat that. They just say, okay, here's a script, here's a pill. Takes 2 minutes, done, patient's happy. They come back a week or two later, maybe the knee pain's better, but now their blood pressure's up. Rather than the doctor saying, maybe a side effect of that pain pill I gave them was high blood pressure, they just say, oh, your blood pressure's high, here's a pill for that blood pressure. Oh. See, you see a cascade going here.
Right.
And then they come back 2 weeks later and they say, all right, doc, now my blood pressure's good, but my ankles are swollen. Rather than stopping and thinking, the most common side effect of that blood pressure pill is ankle swelling, they just say, oh, here's your water pill.
So that's 3 pills in already.
Right. So you see, this is what we call the prescribing cascade, whereas instead of looking and getting rid of those medication, you've gone ahead and added 3 new pills that we're seeing more of a issue with the side effects than the actual benefit.
Wow.
So understanding that a pill for every ill, we sometimes say, is not always the best way to go about doing things. And we should always consider, in geriatrics, we say, consider any symptom to be a drug side effect before anything else. So the first thing, whenever anyone comes to me, whether it's a rash or a cough or swelling or a lab abnormality, the first thing I'm doing is looking at their medications. I'm saying what's new, what's stopped, what dose has changed, what might have you been taking over the counter that you thought might help from either the supermarket or the pharmacy. And 9 times out of 10, by reducing something, I can make that symptom go away.
Thank you so much for sharing that great information.
My pleasure.
Be sure to watch more episodes on this topic and other issues of interest to all patients here on Aging Gracefully. We will see you next time.